I think that there's a lot of confusion right now around meaningful use and how it affects specialties like radiology. And I think that people have to start understanding that there is an immediate impact and it's impacting them now, and they have to very carefully start to plan how they're going to take that step forward. And some of the areas that there's a lot of talk around certification and what products are going to do and what vendors are going to do to certify, and I think that one of the areas that people are missing the point on is that these specialty operations have to think and understand strategically how they're going to comply to meaningful use, yet at the same time be efficient and optimize their practice. And I think that one of the strategies that CARESTREAM can help with is to really help them drive efficiency in their operation as they comply to meaningful use. Take advantage of some of the flexibility that our portfolio has, take advantage of the customization and the ability for the software to adapt as meaningful use adapts, to really give them the opportunity to have meaningful use not be a negative impact. The ability to capture that data at the right point and the right time of the workflow, and then share that information with other systems. And that's a key point that I think that our customers are really thinking about, and that vendors aren't providing a good answer for yet. And that's where I think CARESTREAM can help. We have quite aggressive plans. We're going to RSNA with a group of the meaningful use requirements already in the application, and we're showing it at RSNA. It's commercialized, it's ready to go. We want to expand that portfolio, and we're going to go for certification the beginning of next year, Q1, early Q2, and the goal of that is to go with a larger subset, and we're going with around 16 of the meaningful use areas. And for radiology specifically as a specialty, that's quite aggressive and quite a bit in a RIS. And again, it goes into the mindset that we have to provide the functionality in the proper workflow. We want to be able to communicate with other systems, accept the meaningful data that are coming from upstream systems. We want to be able to view and manage that data in our system, and we want to be able to capture data and then pass it downstream. And that's the key, is that you want your system to be able to fit into the meaningful flow in an unobstructed way. The area that I think that the RIS can provide a unique advantage is, again, our ability to adapt very quickly. The foundation that we have in the RIS system can adapt as meaningful use changes, and I think really where it adapts is we can natively speak all the meaningful use standards and the criteria of all the data that we're passing. So downstream systems can pass us the data, we can display it, it can get modified, manipulated, entered into the system, and then we can pass it upstream. So again, you don't want to ever have to enter information in two systems. And I truly hope that facilities that are out there are making sure that they're planning their system flow in such a way that they're not duplicating information and entering it in two systems, because you're just going to pay for it in efficiency in the long run.